Hello, my name is Darren Patz, and I am a senior in high school. I intern with Dr. Rashmi Parmar at our dental practice in Clarksville, Maryland. She works with patients with sleep apnea, and I have been researching it thoroughly. This video is meant to educate doctors and patients about sleep apnea and how to treat it using oral appliance therapy. Obstructive sleep apnea, or OSA, is a potentially fatal disease that affects millions of Americans today. Many people are unaware that they have OSA, and a small portion of those that are aware of the disease are properly treating it. Obstructive sleep apnea can cause extreme fatigue, cardiac problems, depression, high blood pressure, diabetes, hormone disruption, stroke, and in some cases, even death. It is quite obvious that the treatment of obstructive sleep apnea is of the utmost importance. One treatment option for the treatment of obstructive sleep apnea is called oral appliance therapy. Oral appliance therapy advances the lower jaw forward so that the airway is not obstructed during sleep. Many dentists today are using oral appliance therapy to treat obstructive sleep apnea and are helping to improve and even save the lives of their patients. Sadly, there are also many doctors who are not properly educated regarding the treatment of obstructive sleep apnea and are unknowingly not fully treating the patient's sleep apnea, or in some cases, worsening the symptoms. An uneducated dentist that treats OSA could not properly adjust a patient's oral device, therefore not allowing him or her to reach their medical maximum improvement, or over-adjust the device, causing the sleep apnea to worsen. I am going to go through the proper steps that should be taken when treating obstructive sleep apnea so that both dentists and patients can benefit and use this knowledge to confirm that they are providing as well as receiving adequate treatment. A dentist should first review a patient's medical history and past sleep tests. This will allow the dentist to confirm that a patient truly does have obstructive sleep apnea and can be treated. If the dentist confirms that a patient has obstructive sleep apnea, then the dentist should properly educate the patient based on his or her specific needs. A patient must understand what their sleep study means and has to set up a consultation with his or her dentist.
So at a consult visit, the first thing we do is we review the sleep study the patient has gone through overnight. Somebody has to sit down and explain as to what that actually means in terms for the patients. So we look at the sleep study, we define how many times per hour they are stopping breathing, what is their oxygenation level, what position they are really worse at, what stage of sleep they are worse at. And once the patient understands their sleep study, how is it affecting their sleep, quality of life, and daytime functioning, and what is the risk on their health with cardiovascular, high blood pressure, diabetes. Once we explain those, patient really always wants to know what are their options for treatment. And most of the time, the options for treatment are either CPAP or an oral device. We explain to them all the different types of oral devices, and we do an exam, oral exam, to make sure that the patient is a good candidate for an oral device. Once they decide that we guide them towards the type of device they want to choose. We go through the pros, the cons, the side effects of all the disease, make them understand the amount of time it's going to take for treatment, and they understand at the end we still have to do another study to update and make sure that the device is working, and if it does not, what is their other options with combination therapy, going to CPAP, or losing some weight. And the most important part the patient really needs to understand is this is a disease that's not cured, it's only controlled. So yearly follow-ups, just like with their sleep physician, CPAP, they have to follow up with us. And the side effects that happen will be mitigated. And their health is in their hands, basically. We are their guiding force.
Next, the patient's jaw mobility should be measured to confirm that a patient is oral appliance therapy compatible. After a patient is known to be oral appliance therapy compatible, he or she must be fitted with the correct device. No one device is best for all patients, so a dentist should recommend the best device based on the individual patient's conditions. Dual therapy may be necessary if the patient is extremely severe. After a device is fitted and given to the patient, the dentist should periodically, 2 to 4 weeks, meet with the patient to assist with the calibration process. The calibration process is crucial in reaching a patient's maximum medical improvement. The dentist should also look out for and fix any potential side effects or complications that arise. The dentist should also take the patient's vitals and measure his or her height and weight. These measurements are used to calculate the body mass index and will allow the dentist to see how these measurements change during treatment and use them to help improve treatment. For example, weight loss can lower the severity of one's sleep apnea. Once the dentist believes that the patient has reached their medical maximum improvement, the dentist should prescribe a follow-up polysomnogram to confirm that the treatment is successful. This step can allow the optimization of treatment, benefit a dentist's practice, and serve as proof of the legitimacy of oral appliance therapy. Finally, the dentist should annually meet with the patient or meet with the patient after significant dental work to ensure that the device is working properly and the patient is still experiencing improvement without any serious symptoms. If obstructive sleep apnea is properly treated, it can be life-changing. Confirm that we are treating obstructive sleep apnea to the best of our abilities.